Hello, SPN members. Michaela and I are hoping your summer is off to a great start. Hopefully, the months ahead bring you some time to enjoy all the traditions of summer, whether it's family vacation, time at the beach or pool, or my personal favorite, eating tons of ice cream and sweet summer fruits. Even in the midst of the joys of summer, we recognize that this continues to be a really challenging time for many across our country, with much uncertainty about where our country and the world is headed, and near daily news of changes that impact our patients and families or that threaten our practice as pediatric nurses. Top of mind for me at the moment are the immigration enforcement efforts that are disrupting and threatening communities around the nation, causing families enormous fear and prompting them to avoid public places like hospitals and clinics, which of course impacts our ability to provide much needed care to children and youth. I'm also really saddened by the Supreme Court decision upholding a ban on gender affirming care for minors in Tennessee, and I'm worried about the precedent that this sets for care for our transgender youth. And of course, we're still waiting to see the extent of the impact from proposed cuts to Medicaid, which insures 40% of children in the United States and will have major implications for hospitals and health centers around the country.
There have also been some critical developments on the immunization front that will directly impact the health and the well-being of children and our roles as pediatric nurses. On June 25th, the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices met for the first time since all 17 of its voting members were dismissed by the new Health and Human Services Secretary, Robert F. Kennedy Jr. In their place, 8 new advisors were appointed, though one reportedly stepped down prior to the meeting. Concerningly, several of these newly appointed members have a public history of spreading vaccine misinformation. During the meeting, the new committee announced that they would be conducting a review of the current child and adolescent immunization schedules. While the stated purpose may be evaluation, the underlying message implies that the existing evidence-based vaccine policies are somehow flawed. This shift signals a potential threat to the integrity of public health guidance, especially for our most vulnerable populations and those that we serve, infants, children, and adolescents. As pediatric nurses, we know the importance of basing medical decision-making on strong scientific evidence. Vaccine misinformation puts lives at risk. It undermines public trust, weakens herd immunity, and opens the door to the resurgence of vaccine-preventable illnesses. That's why now, more than ever, it's critical that we speak up, stand together, and advocate at every level, locally, statewide, and nationally.
Moments like this call on us all to be advocates for the health of the children and families and for our profession of nursing. I was heartened to see pictures from this year's American Nurses Association Hill Day, when over 500 nurses from around the country gathered on Capitol Hill to meet with legislators to express support for programs like Medicaid and for continued funding of nursing workforce development initiatives. Let's all commit to finding a place to make our voices heard and to use our expertise on behalf of the patients and families we serve. The time is now to own our role as advocates and to speak up for the health of our country.
As frontline caregivers and trusted resources of information for families, our voices matter, just as Jenny mentioned. I'm proud to share that SPN's Healthcare Policy and Advocacy Committee is actively developing both an immunization position statement and a white paper to provide clarity and evidence-based guidance on this issue. These resources will be instrumental in helping us all address misinformation, support informed discussions, and guide sound advocacy in our practice settings. Considering the developments that we mentioned, we want to also encourage you to share your own expertise and contribute to our collective voice. Abstract submissions are now open for the 2026 SPN Annual Conference taking place in Orlando, Florida from April 27th through the 29th of next year. This is a powerful opportunity to showcase your evidence-based practices, research, and innovative approaches to pediatric care, especially during this critical time of upheaval and misinformation in the U.S. healthcare system. The deadline to submit is Friday, October 3rd, so start preparing now to share your knowledge with the larger pediatric nursing community. Finally, we want to remind you to connect and collaborate on the Hive, SPN's online forum. It's a great space to share resources, ask questions, and to support one another, especially as we navigate through these uncertain times together. Thank you for everything that you do to protect and advance child health. Your voice, your knowledge, and your commitment are more important now than ever. Let's continue to lead with science, compassion, and courage. Take care, and thank you all for your time.